slaw. Oral candidiasis, also known as thrush, is an infection caused by a fungus that forms white spots in the mouth and on the tongue surface. Thrush is most common in the elderly and infants, but it can affect people of all ages. Signs of slush. The emergence of white patches in the oral cavity and on the tongue surface is the most prevalent sign of thrush. Oral and throat candidiasis stains are easily confused with milk stains or milk substitutes in babies. Wiping these places to try to eradicate them is a bad idea because it creates cuts and discomfort. Some babies with oral and throat candidiasis exhibit symptoms such as stress and unwillingness to eat. Thrush causes and risk factors. Because their immune systems are still not powerful enough to handle the infested fungus, thrush causes mouth and throat candidiasis in youngsters when the fungus candida in the body gets out of hand. Because the immune system weakens and diminishes with age, the elderly may get oral and throat candidiasis, and some persons may acquire oral candidiasis as a result of taking certain drugs, such as antibiotics or inhaled corticosteroids. Oral and cyclic candidiasis are more common in people with a variety of health issues, such as diabetes or AIDS. Complications with slush. Thrush does not usually cause difficulties in healthy people. People with thrush may experience the following complications. Children's malnutrition as a result of eating difficulties caused by oral and throat candidiasis. Throat irritation. Diagnosis of slush. In the vast majority of cases, doctors can diagnose thrush simply by looking at the mouth cavity and the white spots inside it. If the treating doctor feels that the patient has another condition, such as diabetes, which can cause oral and laryngeal candidiasis, he may offer particular testing to diagnose this disease as well. Therapy for thrush. Children's thrush is usually not severe or harmful, and it can be treated with antifungal medications like Nystatin liquid. The medication is usually given directly to the white patches in the mouth. Fungi can cause a diaper rash in children with candidiasis, and in this situation, the child may need to be treated with Nystatin ointment. If it fails, the doctor may prescribe an antifungal pill medication. The following methods are particularly helpful in cases of thrush in children. Use boiling water in nursing mom's nipples, feeding bottles, and pacifiers to ensure complete and thorough cleaning. If the mother is nursing and the kid is breastfed, special attention should be paid to washing and sanitizing the mother's nipples with Nystatin. Oral and throat candidiasis can be passed from mother to child through breastfeeding. Drying the mother's nipples and applying lanolin ointment after each feeding should be prioritized. If a person has oral candidiasis and wears a denture, it is important to stress proper oral hygiene in the dentures, especially at night. The denture should be soaked in a special container that can be purchased at any pharmacy and then washed thoroughly after soaking. Prevention of thrush. Thrush is an infection caused by a fungus that grows on the tongue surface and inside the mouth. Oral and throat candidiasis affects newborns, infants, and adults, but thrush can affect anyone at any age. Oral and cyclic thrush do not usually cause complications in healthy newborns and infants, and they are relatively easy to treat. It is recommended to take care of the following to prevent thrush and avoid its appearance. Keeping the oral cavity clean and free of bacteria. Hand washing is emphasized. If you are taking antibiotics in liquid form, make sure you rinse your mouth with water right away. Ensure that diseases that increase the risk of oral and throat candidiasis, such as diabetes, AIDS, and cancer, are properly treated. When using corticosteroid inhalers, make sure to use a barrier method and wash your mouth immediately afterward. People with AIDS who have a weak immune system will benefit greatly from oral cavity preparations such as Listerine. To prevent the incidence of oral thrush in children, adopt the following precautions. Treating vaginal yeast infections, particularly in the final 3 months of pregnancy. Daily washing of breasts, feeding bottles, and straws. To limit the possibility of fungal growth, keep ready-made bottles in the refrigerator. After an hour of feeding the infant with the bottles, do not use them because the fungi on the surface of the bottle nipple will have grown and multiplied. Boil or put in the dishwasher all the utensils that the youngster puts in his mouth for 20 minutes. As soon as the child's diapers become wet, change them. When feasible, breastfeed the baby.